Welcome to MetroSTL.com. I'm Charles Jaco. We're pleased to be joined today by Dr. Clay Dunagan. He is Chief Clinical Officer over at BJC and is with the Metro St. Louis Pandemic Task Force. Doctor, a pleasure. Thank you very much for being with us today.
Happy to be here, Charles. Thank you.
As the Delta variant is surging across Missouri, what does it look like here in St. Louis? Are we getting any of the overflow from rural hospitals, or are we seeing a large number of Delta cases ourselves, or right now, is it fairly manageable?
Well, there's several questions in there, Charles. The first one is we have seen a few cases of overflow as they've run out of space and equipment down in Southwest Missouri. That hasn't been a huge impact on our health system, but there have been a few patients that have made their way up here to different area hospitals. We're doing okay right now, but we have been busy trying to make up for time lost last year in completing necessary healthcare activities. So the rise in COVID cases here is starting to already put a bit of a stress on the health system. We're managing right now, but I think we're looking ahead and we see a steep rise in COVID cases, which is going to be a problem.
How much have the COVID cases gone up so far within the recent past?
We are about 3 times as many cases as we had at our low point. We were down in below 100 cases regionally. We're up today. I think there were 260 cases in hospitals in the 4 health systems that make up the pandemic task force.
The mayor of Springfield, Missouri, yesterday had a warning where he predicted that the surge that is going on in Southwest Missouri now was soon going to envelop the entire state, including the 2 big metro areas. You agree with that?
I do agree with it. I think there is the illusion that it is moving this way and hasn't gotten here yet. But really, all the cases that we're seeing are Delta variant virus, and they're seeing the same thing in Kansas City. So we're just on the steep part of the curve now that they've been a few weeks ahead of us down in Southwest Missouri.
Now, when we talk about a surge coming in this direction, we know that in the 2 major hospital systems down around Springfield, Cox and Mercy, that they've been overloaded. For a while, they ran out of vents. They certainly ran out of ICU rooms. Do you expect a surge of that magnitude here, where between homegrown cases and overflow cases, we might reach a point of criticality with either ICU beds, ventilators, or both?
It's certainly possible. We don't know what the somewhat higher vaccination rates in the 2 metropolitan areas referred to will be, and what their impact on the surge that we're going to see is going to be. But we do know this is going to move very quickly through unvaccinated populations, and there are plenty of unvaccinated individuals in both urban areas. Whether it's going to get as high as it did in the winter depends somewhat on what our actions are at this point. I think we need to return to more social containment measures, and we certainly need to get our vaccination rate up as quickly as possible.
St. Louis County had recommended, but was not yet mandating, wearing masks indoors. Again, when you go to the grocery, when you go to the hardware store, that sort of thing. Do you think we need to go back to a mandatory warning where stores put up signs and say, if you're not masked, whether you're vaxxed or not, you can't come in?
Well, if we could get to a mandatory mask order, that might be something to consider, but I don't think there's time for the political discussion that would be required. I do think that we need citizens to take personal responsibility for protecting themselves and thereby protecting their friends and neighbors. So I'm firmly in favor of people starting to wear masks when they get into indoor environments or any place where there's a significant number of people whose vaccine status may not be known.
Do you think we should go back to the precautions we were having over the winter, which is that indoor dining, if you're not masked, is just a no-go, we shouldn't do it and things like that? Or are we there yet?
I don't know that we're there quite yet, but I think we need to move pretty quickly to individuals when they're in with other people. If they can't maintain social distancing, they should definitely wear a mask, whether vaccinated or not.
Now, the head of the CDC said that we're heading toward in her words, an epidemic of the unvaccinated. Is that your experience now, that almost all of the cases you're seeing are among the unvaccinated, or have there been a few breakthrough cases?
Well, there are certainly breakthrough cases, and we see them both in the outpatient setting and some inpatients. I think the national number is roughly 97% of hospitalized patients with COVID are unvaccinated. We have seen a little bit higher rates of vaccine failures in our population, but I think that's because of the number of patients we take care of that have immune compromising conditions and medications. But roughly, you can think of the vaccine failures that get in the hospital as being single digits. Outside the hospital, there probably is a somewhat larger number of breakthrough cases. The great thing about vaccination, though, is that so far it seems to be strongly protective against serious illness and hospitalization.
So, as a medical professional, it sounds as if you're saying that if not the magic bullet, but the primary tool to protect us against this surge is coming is for people to get vaccinated, pure and simple.
That is absolutely right. And more importantly, the vaccination campaign really gets us leverage for the long haul. So to get rid of COVID once and for all, to get it back in the box so that we can go about our business normally, vaccination is really the only way, short of having everyone get the infection and get immunity that way. I do have to repeat, though, in the very near term, if we're going to bend this curve that we're seeing right now, we're going to have to return to more aggressive masking and distancing.
But again, you don't think we're to the point yet where there needs to be a mandate? You think we're going to hit that point at some point?
It's possible. I do think that we could see levels as high as we did over the winter holidays.
So if you go to Schnucks, or you go to Deerberg's, or you go to any supermarket right now, you go to a Home Depot, you go to Lowe's, you go to Ace Hardware, any place like that, are you masking? Would you urge others to mask in those same situations?
I absolutely am masking. I absolutely urge all my friends and relations to wear masks when they go into those settings, or any setting where they don't know vaccine status of the other people that are there.
This has become not only a medical crisis, but in many ways a political crisis, because a lot of the vaccine hesitant, not 100%, certainly not in the African American community, which is a different set of parameters. But these are folks who might have listened to former President Trump about the vaccines, watched the vaccine denial that's airing nightly on places like Fox News. And I know personally from my experience, and it's been incredibly frustrating, that when you try to talk to people, even with the facts about this, that, hey, I've gotten the vaccine, nothing happened to me, it's not dangerous, here are the statistics, et cetera, it's almost like water off a duck's back. You speak to them about vaccines, and they will speak to you about ivermectin, a heartworm treatment, for heaven's sakes, that some people are taking. As a medical professional, how do you look at this? How do you break through that wall of insularity that seems to be, for want of a better phrase, immune to facts?
You know, among the vaccine hesitant, there's a broad spectrum of the degrees of belief and the strength of it. I think in most cases, when people have done careful surveys, it's really a fairly small percentage who are adamantly opposed on often political or philosophical grounds against the vaccine. In those cases, it's very difficult to find the argument that will win the day. What we've seen most likely to change those opinions is the severe illness or death of a loved one or an associate from COVID. But even in those cases, there are certainly people who continue to deny to the end of their days that they've had COVID. For other groups, I think there's the opportunity to really engage in understanding what their fears and concerns are. And I also think that every day, as people see more and more that the hundreds of millions of people who've been vaccinated are doing fine, I think that starts to win people over. We have seen some upturn in vaccine rates recently, and hopeful that that will continue to accelerate.
The vaccine rates, as you noted earlier, are more robust in the St. Louis and Kansas City metro, but they're still hovering around the 50% mark. In some of these counties, you're looking at vaccine rates below the 20% mark.
Yeah.
To move that needle upward, is it one-on-one communication, you think, from friends and loved ones who've had the vaccine, from medical professionals? In other words, sort of the epidemiological equivalent of house-to-house fighting, where you have to convince one person at a time?
I think that's the things we're left with, short of vaccine mandates that companies can still implement. We certainly, for our workforce, have issued the policy that we're going to make mandatory vaccinations, and the other health systems have also done that. But outside of those contexts where there is the opportunity for an employer or an organization to do what we think is the right thing and issue a vaccine mandate, it's going to be one-on-one. And I think it's going to take people who can influence others to convince them that this is really the smart thing to do. I think by the time we're done with this, most people are likely to have either been vaccinated or to come down with COVID as an illness. And the risk of the latter are just much more significant than any perceived risk of vaccine.
Are we seeing any changes demographically with the Delta variant? In other words, are we seeing different age populations come in with COVID than we did in the initial surge of what I call the OG variant?
Yes. Yeah, actually, the demographics of the people coming down with COVID exactly match what you would expect from the vaccine efforts. So we've seen a much younger group in terms of the overall age of patients being admitted to the hospital and becoming ill. We've also seen a shift from an urban-centered pandemic to something that is much heavier in rural areas than it was before. And unfortunately, we've seen a return of COVID to the African-American community, and particularly North County and North City, where there's a good deal of vaccine hesitancy. Once again, the proportion of individuals admitted to hospital who are African-American has been going up in recent weeks.
I'd been looking at the breakdowns by zip code, and I was a little shocked that you've got some North City neighborhoods, like around the College Hill neighborhood, and then some North County communities, like the zip codes around, say, Spanish Lake and other places in Northeast St. Louis County, where the vaccine rate is just about as low as it is in rural places like Dunklin and Taney counties. And yet you're dealing with a completely different dynamic there, because here you're dealing with an African-American community that is suspicious of the medical establishment for completely different reasons than the rural white community is suspicious, ranging from the Henrietta Lacks cells to the Tuskegee experiment to just racism in everyday medical care. Quick question. What is the best way, you think, medically to approach that? Is it the same as you'd approach everybody else, one-on-one, or does a special effort have to be made in the Black community in order to overcome vaccine hesitancy there?
Well, the nature of the issue, which is suspicion about the medical establishment and predominantly white industry to this point, plus the historical perspective that you mentioned, that's very real concern, sort of dictates that that same community can't really be the one to carry the message. And I think it's been very important for us to engage clergy in the African-American community or other role models. But at the end of the day, I think most people really listen to those close to them personally that they trust. And so it's really been a networking campaign to try to get individuals who've successfully been vaccinated, understand that it's not a big deal, and have thus avoided an illness, to try to get their friends and relatives to come on board.
From a medical point of view, strictly medical right now, how would you grade the reaction of state officials in Missouri since the beginning of this? And I'm talking about the state health department, DHSS. I'm talking about the governor. I'm talking about the apparatus of the state government. I mean, you smiled there, and I think you anticipated what a lot of people are thinking, that the reaction has been not very good. But I wanted to talk about this from a strictly medical and epidemiological point of view, not a political point of view. Given their attitude, no mask mandate, Governor Parson talking about those dang masks, criticizing both Dr. Garza and doctors in Springfield for, quote, spreading panic and that sort of thing. How has state leadership performed medically as this pandemic has rolled along and is performing now?
I think there are many things the state has done that really were exemplary. I think the wastewater campaign to understand where variants are appearing was a very progressive way of thinking about
it. Now, for people who are unfamiliar with it, that's basically the sewer shed project where they are literally testing wastewater for not only COVID, but testing for the different variants.
That's right. And I do think that the governor's call for personal accountability, maybe delivered a little bit later than we would have liked, was on point. But I think we've also underestimated the speed with which these variants can overtake the population, both at the beginning when we first saw it, in the winter when the Alpha variant, the UK variant, became dominant, and now with Delta. I think the rate of growth of these curves is so much faster than you anticipate that you have to get in front of them. From the medical community, that sounds like we are shouting fire in a crowded theater. But the truth is, we know from prior experience that this moves very fast. And if you don't take quick, aggressive action, you lose control of the moment.
Do you think a statewide mask mandate would have ameliorated any of this when it might have done some good a few months ago?
It'd be tough to say, because I'm not sure even the government issuing a mask mandate would have convinced a lot of people who are suspicious of government action. So it would have been nice to see. Perhaps there would have been other people who would have come on board. I don't know whether that would have carried the day.
It's troubling to some people that we lost our state health director under rather obscure circumstances. We're still not sure why Dr. Randall Williams quit or was fired. And now we have essentially a public relations person running on an interim basis the state health department. Is this confusion impacting messaging, impacting effectiveness of the state response, or has that just not filtered down to the good work these men and women are doing?
I think there's some very good people still in the state health department that are doing a good job. We've talked about the wastewater surveillance. There are very competent government employees that are doing their best to manage this. I can't comment on Randall Williams' departure. I don't really know the circumstances, but typically there are very capable people left behind. Again, I think we're not moving fast enough. But Missouri had the misfortune of really being at ground zero for Delta variants taking off. So we just didn't have a lot of time to prepare for what was in front of us.
What led Missouri to be ground zero? Why did it explode in such a virulent and rapid way here?
Well, the pandemic, the resurgence really had three key ingredients. One we've talked about, low vaccination rates. The second was a quick return from social isolation measures, masking, social distancing. And then the third was the presence of the Delta variant. So for whatever reason, Delta hit a point, a weakness in Southwest Missouri, could have been what is called a super spreader event, where a single individual may have infected a large number. We don't know. But with those three ingredients, a more transmissible variant, low vaccination rates, and low mask usage, I think that was the tinderbox that was ready to ignite with the right catalyst.
Is one of the problems you guys worry about is that a new variant could be cooking up somewhere simply because viruses mutate? It's what they do. and the only place they have to mutate now is in the bodies of the unvaccinated, largely. Given the low vax rates, are you worried that Delta is going to morph into Epsilon or something else that we haven't faced yet while we're busy fighting this, that the next crisis might be upon us?
Charles, I think it's a very real concern. You said it right. Viruses are constantly mutating. There's such a low level of immunity overall in the population, despite all the disease we've had, that without the vaccines to retard spread, we get very high replication rates, many new people infected, and a great opportunity for a new mutant to arise that may be even more infectious than its predecessor. Of course, that's a problem we face worldwide, and areas of the world where there are very, very low vaccination rates are going to continue to produce mutants that may be more problematic than the predecessor.
What is your biggest concern about our situation here in the St. Louis metro area, should you end up with a worst case scenario? Are you concerned that we are going to go back to the bad old days of last winter, where we get overloaded ICUs, overloaded beds in general, vents being used almost to their limit? Are you concerned that this is going to have to, pardon me, put us in a position where people who need other medical procedures are going to have to move to the back of the line while we move forces to fight COVID? I mean, what is your biggest worry? Is past prologue, are we going to go back to that, or are there new worries that concern you?
So one thing that will be different this time is that those individuals who are vaccinated should feel relatively comfortable that they are protected for the most part from severe disease. So it will be different in that respect. But I think you have nailed down the biggest concern, which is without mitigation measures, the health systems are likely to get into a real crunch, just as we did before. And the difference at this point is there's a lot of pent-up demand for medical care that had to be bypassed in 2020. So we're trying to deal with pent-up medical demand at the same time we're facing this wave of COVID patients. I think it's a very real possibility that if we don't find our way back to stronger masking and higher vaccination rates, we will get to that point where the ICUs are overcrowded, that we're having a great deal of trouble taking care of COVID and other medical problems at the same time.
As a civilian, this is just annoying the hell out of me, but I cannot imagine what the situation is for healthcare workers, for doctors, for nurses, for orderlies, for physician assistants, for everybody else in your profession. What's the effect been on the folks there, that they went through all of this and here we are again?
Well, it was gut-wrenching the first time. People were burned out from it. We had to really scramble to make everything work the way it's supposed to take care of not only COVID patients, but other emergencies and other care that needed to be administered. Facing a population in which most of the cases we're now seeing are unvaccinated and therefore seriously ill from a vaccine preventable disease is very discouraging, very demoralizing. In most of our careers, we have seen vaccines used to prevent illnesses that can be quite severe. And for the most part, there's been reasonable uptake in the populations at risk. This is a new situation for most of us where we know that the answer is out there and people are not availing themselves of that. And as a result, we're facing a real crunch inside the healthcare system.
Dr. Clay Dunagan of the St. Louis Metropolitan Area Pandemic Task Force. Dr. Dunagan, thank you very much for being with us.
Thank you for having me, Charles.